How to help your chronically ill toddler exercise. If your toddler has a chronic illness, such as type 1 diabetes, sickle cell disease, cystic fibrosis, or spina bifida, exercise may seem to be a challenge or a nerve-wracking experience. Follow these steps to help your chronically ill toddler exercise safely and effectively. Method 1. Get a professional consultation. 1. Ask for an assessment of range of motion. If your child has an illness that causes muscle atrophy or restrictive movements, certain activities involved in exercise may not be advisable. For instance, if your child has permanently contracted hand muscles, exercise involving throwing or grabbing is likely to frustrate your toddler. 2. Ask for a balance and coordination evaluation. Most pediatricians can give reliable opinions on the safety of exercise options that involve balance and coordination, such as dancing, jumping, bicycling, and running. If your toddler's illness affects balance or coordination, exercises that rely heavily on these characteristics may be dangerous for your child. 3. Ask for safe exercise suggestions. In some cases, most exercise for your toddler should be first demonstrated by a physical therapist and then repeated with your guidance during exercise sessions. Children with less restrictive illnesses may be able to safely engage in a wide variety of exercise options when they are feeling well. Your child's symptoms will be the guide of how much and what types of exercise are appropriate. Method 2. Start with low-impact exercises. 1. Help your toddler stretch in place. Teaching your child to stretch as a precursor to exercise can not only help prevent injury but also increase your child's range of motion and strengthen muscles. Perform simple stretches by stretching each arm individually across the chest and holding it in place with the other, or sitting in place and reaching for the toes. 2. Do arm and leg lifts with your toddler. If your child is restricted to a bed or wheelchair but is able to move his or her limbs, show your toddler how to alternate lifting one arm or one leg at a time. Make it a game by reaching for apples or kicking at balls to make these simple exercises more interesting and engaging. Perform multiple sets of 5 to 10 repetitions each if your child is able. 3. Swim with your toddler. Swimming helps strengthen muscles and confidence while relieving stress on joints. If your child's doctor believes that swimming is safe for your child, join a parent-toddler swim class at a local gym or take your toddler to swim with you at a community pool. 4. Help your toddler ride a low-set tricycle. Small plastic tricycles are often very stable and low to the ground, reducing the chance of a fall. Tricycles help your child build lower body strength and stabilizer muscles that assist balance. 5. Rest frequently with your child. Regardless of your child's illness, it is likely advisable to encourage him or her to rest frequently. Inform daycare or childcare centers of your child's illness and the importance of appropriate intervals of rest during play and exercise. Method 3. Make play time filled with exercise. 1. Dance to music or movies. Children can get lots of physical activity in dancing to music or following sing-alongs and musical children's videos. If your child is capable of safe dancing, encourage him or her to dance to the radio or to CDs or DVDs. 2. Encourage playground games. If your child's chronic illness does not restrict motion, encourage your child to play with other children in regular activities as often as possible. Playing tag, swinging, and using the slide are all effective workouts for children and can also help them build social skills with other children. If your child's illness does not permit rigorous play or much interaction, take your child to the park when it is less crowded and push him or her on the swing, hold your toddler up to play at the monkey bars, or walk through the park before having a picnic. Walking can be sufficient exercise for toddlers with restrictive illnesses. 3. Invent your own play-time games with appropriate exercises. If your child's mobility or strength is severely limited, make up your own play-time exercise games that your child can safely perform. For instance, play pretend symphony conductors by waving arms to music, race to stack cardboard blocks into a building, or play a horizontal jumping game with a bedridden toddler to see who can push a pillow the farthest by bending and extending the legs. Tips. Join a parenting support group for families raising children with your toddler's chronic illness. Fellow members may have safe and creative ideas for exercise that they used with their own children at that age. Warnings. Do not perform rigorous exercises with your toddler while he or she is in a period of illness. When your child is feeling well, exercise should be performed regularly with parental or professional supervision.